Welcome to the Listen Up podcast, where we explore hearing loss, communication, connections, and health.
Hi, everybody. Dr. Mark Sims here. I'm the host of the Listen Up podcast, where I feature top leaders in healthcare. This episode is brought to you by Listen Up Hearing Center. I help patients to effectively treat their hearing loss so that they can connect better with their family and friends and remain independent. The reason I'm so passionate about hearing loss is because I lost my brother Robbie twice. First to his hearing loss from radiation to his brain tumor, and then when he passed away. I only care for ears. I'm the E of ENT. I've taken care of many, many thousands of patients with hearing loss and performed over 10,000 ear surgeries. I'm the founder of the Listen Up Hearing Center. I've written a book as well called Listen Up, A Physician's Guide to Effectively Treating Your Hearing Loss. If you want to learn more about it, go to www.listenuphearing.com. That's www.listenuphearing.com. Today, I'm excited. We have Dr. Patricia Gaffney. She is a professor at Nova Southern University in Fort Lauderdale. She earned her doctorate of audiology from the University of Pittsburgh in 2007. And then shortly thereafter, she joined the NSU staff. She's also the director of the NSU United Kingdom Doctor of Audiology program. At NSU, she teaches advanced vestibular course, geriatric audiology, and amplification. She's very involved in AAA, which is the American Academy of Audiology, and other audiology organizations. She's also the president of the Audiology Practice Standards Organizations, and that's why we want to talk to her today, because we're going to explore that topic and what they're doing further. Tish, welcome to the program. Thanks for coming on.
Thanks for having me.
Yo, this is great. So tell me, how did you end up in audiology? What's your kind of, you one day you decided I'm going to be one of those. So how did you end up there?
So, I thought I was going to go into medicine, and I realized chemistry and I are not the bestest of friends. But actually, really what kind of pushed me towards audiology specifically is that my uncle was an ENT himself. And during the summers, I would go and visit him and kind of help out in the office when people were on vacation. And I got to watch him, and I got to watch his audiologist. And I really enjoyed the audiology aspect of it. And so my freshman year of college, I entered into, speech and hearing science, and kind of was that from then on.
Oh, well, that's great. And then, so you went to University of Pittsburgh and then ended up at your current position shortly thereafter, right?
Yeah. So I graduated from Pittsburgh, and then I did my externship at the VA hospital in Miami. And I was there for just 2 years after my externship. And then this position came available, and I applied and got it. So yeah, I've been here for a while.
Well, good for you, right? Pittsburgh's a beautiful city. I grew up in Philadelphia.
Oh, I'm from Philadelphia too.
Are you? Where are you from in Philadelphia?
From the suburbs. We lived in a few different places: Bryn Mawr, Drexel Hill, Broomall.
So I grew up outside of the Northeast in a place called Huntington Valley. So we're both from Philadelphia. Yeah, I went to Jefferson Medical College in Philadelphia, so we're familiar with it. But and many people, I love Pittsburgh, great city, but and Philadelphia too. But the weather is substantially nicer in Florida.
It's very hot right now, though, I will say. This is the very hot and rainy season, so it'll be nicer in about 2 or 3 months when it's winter.
Every place has a little bit of its downside, perhaps.
Yeah.
Right? But so, I had a prior guest talk about the audiology standards organization, right? Am I getting that right?
It's Audiology Practice Standards Organization.
Okay. Yeah. And so can you tell me a little about the origin of that organization? In other words, what spurred it on to exist? You were the founding president, if I'm not mistaken.
I was not the founding president. I was on the founding board, though. So, so it really started with John Coverstone, who's now our executive director for the organization, Lindsay Jorgensen, and Jenna Tunnell and Gail Whitelaw, so a few audiologists. So John Coverstone has a podcast that he always does live at the AAA conference, and they happened to come across, a topic of practice standards. And really in the audiology profession, we were really lacking practice standards. There is a set of professional standards, and we have a lot of guideline documents, but we don't have any practice standards. And so after some discussion, they started to seek out an initial board to kind of flush out, what that would really mean for audiology and how to kind of get moving on that.
Can you differentiate? So you said you had some guidelines and the professional guidelines and practice standards. So for the listeners, I mean, I'm not saying I have a pretty good idea what the differences is, but they all kind of sound the same. So can you tell me a little bit about the differences? That'd be great.
Yeah, absolutely. So a lot of other professions do have standards. And so we were really lacking in that compared to some other professions out there. So standards are what you do, what the average audiologist does in an average patient situation. And we can kind of think of that as like the foundation, basically like the bare minimum you should be doing for clinical practice.
Right.
And that would apply across the board. Now, when we look at guidelines are a higher level document. They look more at what is the best practice. So here's what the average person would do, but what would really make that the best practice? And so guidelines are kind of that higher level function. And that's really what we should be aiming for. But standards are really kind of that baseline, and they should correlate pretty well with things like licensure rules for states and things like that are at that kind of bare minimum versus the guidelines and gold standards that are higher level.
Okay. And so, yeah, that makes sense. So in other words, by analogy of a building, the floor versus the ceiling, right? In other words, we don't want you to go below this floor, and we want you to aspire to get to the ceiling, right? So
Absolutely.
You're kind of setting what is the standard of what the least you need to do, right? Because as we know, it is practice, and there's an art to it. So different people certainly have different beliefs. We all know, and in the practice of the field of medicine, there's a lot of passion. I mean, people can have oppositely opposed ideas, and they're very passionate, and they support it with data and literature and all of that. We all have those controversies in our own field. So
yeah.
So okay, so you get this group together, then what? I mean, that sounds like a pretty big level. Or do you use the guidelines as the documents? I mean, what's the process of creating a standard?
Yeah. So what we end up having is two subject matter experts groups. So we pull together experts in whatever topic standard that we want to work on. And so we gather a group of subject matter experts, or SMEs, and they look at the literature. They may reference guideline documents if there are any, and really survey the landscape as far as literature to determine what should be in that standard document. What are really the foundational skills or procedures we should be doing for that topic, that guideline standard we're trying to work on. So that's the initial subject matter expert group. Then once that's written, it then goes to a verification group. So this is a completely different group of subject matter experts who are then going to verify and kind of evaluate what the first group did. They may pull other literature. They may say this doesn't really meet, what we think would be, a standard level of practice. And then those comments then go back to the original group, where the original group then revises as needed. Do they agree with the verification group? Do they fill in what needs to be filled in? It then has a board review. It has a public review. Any comments from the board or public review then go back to the original group, and then they either incorporate those or justify why those comments are not necessary. We also run it by an ethics panel and a lawyer before we ever publish the standard.
So needless to say, highly deliberative, meaning a lot of collaboration and deliberation. So if I'm not mistaken, not that there's not a lot of important work, but it sounds like the yeoman or the heavy lifting is being done by the first committee.
Yes. Yes.
Because if I could summary, they're culling all the literature. In other words, finding all of the different articles. They have to read them all, decide if they're valid, take the points, and then hope to have a literature supported, or meaning research supported tenets within that standard. Correct?
Yes. Yeah. That first group does the heavy lifting for sure.
Yeah. And so are there any cases where, there are things we do, as much as we want to admit it, where we actually don't have literature to support it, which is an interesting concept, but some of it's just habitual, or, we do it, it kind of makes sense. And maybe there's not actual research that supports doing it, but we know it works empirically, if that makes sense. And so I guess there is probably some stuff of that nature. Is that not the case?
That is the case. Thankfully with the standard, because it's so bottom level, there is a lot of data to support what we do. I know when you start getting into those higher guideline level documents, like I've seen in guidelines where it's like, we don't have any literature to support this, but acoustically, we know this is valid. So Yeah, well, it's not as much in the standard, but yeah, that definitely comes up. And as we work our way through more standards, it's going to come up more often, because right now we've started with some of the more basic aspects of audiology. And as we work towards some of the specialties, I think it's definitely going to be a situation where we don't have as much literature to back certain things.
Yeah, having looked at the ENT guidelines, sometimes it's strongly supported by literature, sometimes supported by literature, not supported by literature, strongly opposed by literature, right? I mean,
Yeah.
so, and obviously there, as the research evolves, there are differing opinions, right? I mean, when we were talking in the warm up, you were talking about how you have all of these different bios, right? And so the point being is there are multiple bios over the history of time, but there's only one that's actually right, but you don't get to erase the old ones. And it's the same for research, right? There's research that probably was shown later to be incorrect. You don't get to like go back and like say, okay, can we delete that? So you have to cull through all that, correct?
Yeah.
And so what are some of the standards that have already been developed?
So we have 2 that are fully published. So
Great.
we started so just to kind of give some timeline, we started in our first board meeting was November of 2017. So we've been around for a very short period of time, plus having COVID in the middle there where everything kind of got a little chaotic. But so we have 2 standards that are complete and published, and they are available to anybody. You do not need to be an APSO member to access them. We hope that everybody will use them.
Sure.
So the first one we did was intake. So, gathering that intake information, demographics, as well as case history, kind of the first step of any appointment. And then the other one that we published was adult and geriatric hearing aid standard.
Okay.
So those are the 2 that are complete.
A lot of lift in those 2. Like, I mean, in other words, highly, highly impactful. I mean, obviously probably not as much controversy in the intake. Probably the second one, maybe a little bit more back and forth. Is that the case?
Yeah, there definitely was some back and forth. We had some great subject matter experts on it. Some of the really heavy hitters in the field. So the nice thing about that was they already knew the literature.
Right.
So
because some of they generated some of it,
ready to go.
Some of it's their articles, I assume.
Yes, I'm sure. Yeah, some of them probably were their articles. So those were some heavy lifting ones to start. It was also, a time for us to understand really that process. And it took us a while to wrap our own heads around a standard versus a guideline. And John Coverstone, who's now our executive director, he was our first president. He had worked on other certification groups and things like that. So he had kind of an understanding of how to facilitate these meetings. So he facilitates them. And oftentimes we have to kind of pull people back and say, okay, you're kind of getting too high level. You need to back it down to that standard level. So it took us a while to kind of wrap our heads around how this was going to go. But since then, everything has progressively gotten a little bit faster because we have a rhythm now to doing things.
And just, the logistics, right?
Yeah.
When does how long do you have to read? I mean, I don't know about I haven't, but, sometimes this can involve hundreds of references. And so somebody's got to read them all and distill them down, right?
And, just try to get everybody on the same meeting, when you have professionals across the country doing all sorts of things, trying to get everybody together to have that discussion instead of, you can work independently only so much. You do need that collaborative discussion. And that also can hold things up where people you can't get enough of them together to kind of pull that discussion through.
Well, so, certainly geriatric amplification is a highly impactful, maybe hazard to say the most impactful guideline that you might be working on in terms of just number of patients that it applies to. So what are some of the things in there? In other words, what does that look like in terms of the low level or base type of care? What type of tenets are in there?
It's the things that you would expect to be in there, right? So you need to make sure that you have an accurate audiogram before you decide to fit this. You need to measure uncomfortable loudness levels. You need to do a full assessment of their needs. What do they need? A selection process. The verification process. That's probably the point that hits people the most controversially is doing real ear and verifying that hearing aid fitting. Providing appropriate follow-up post hearing aid fitting. So those are the types of things that are in there. I don't have it pulled up in front of me
No,
to
it's okay.
read it line by line, but yeah, it's the stuff that you would expect to be in a document, but it is laid out in a process and supported by literature.
But
So
very important work. But if you and I started going over the nitty gritty of it, I think many people might turn this off, right? In other words, well, I think that's especially I do know real error measurement is obviously a standard, but there's a struggle of acceptance of the standard versus practical application of the standard, meaning there are, for instance, the statistics suggest there are more real error measurement devices out there than there are people using the real error measure. So there are many laying idle, if that makes sense.
Yes, there are many laying idle.
That's great. So, and where's the future? In other words, obviously there's not for anything, but I suspect I can talk to the current president 20 years down the line, and this work will still be being done. So how about kind of a headlight view? What can you see in the next 200 yards or proverbially?
Yeah, so we have pediatric amplification guidelines that should be ready in the next couple months.
Great.
So we had the one nice thing was we did adult amplification and then we followed it up by pediatric amplification, and some of the subject matter experts were the same. So we had a nice jump start on that.
They're amplification experts, right?
Yeah. So there was a few people who were like, peds are not my thing, so I'm going to roll off. And then we brought some pediatric specific people on, and then we had a continuity between both of them. So that one should be coming out very soon. We have adult diagnostics at the verification subject matter level. So the initial standard has been written. We're pulling together that verification group to go over that. So that probably will be about maybe mid to late to 2023.
Wow. You're moving along.
And then, we're trying to decide where to go next. So those two are well in the pipeline. We don't want to have too many going at once just for management of all of that.
Unless you get
but
people.
We've been,
Unless you get more people, right?
Yeah.
That's the thing, right?
Yeah. So, we've been contemplating, should we go into, and then pediatric diagnostics will probably be the one following that, doing adult and pediatric diagnostics. And then from there, it's where do we go? So we've been kicking around vestibular, tinnitus, oral rehab. So we definitely, there's no shortage of topics for standards. The other thing is that we are putting them on a rotation. So in 5 years,
right?
Yeah, 5 years post publication, sorry, we're going to review it and make sure it either is okay as it is, or does it need to be updated? So, certain ones will probably stay fairly static, even though
but you still know it's more current, right? In other words, even if it doesn't change, we reviewed it, we looked at it, we still believe it's in that, rather than people say, 2028, that's from 2021. I don't know if that's valid anymore. So I think you need to do that, definitely.
Yep.
And so, I will tell you, I know there are many people in the space that cochlear implantation is something people probably.
Yep, that's one we've talked about too. Yes. Yep.
So, obviously the people in the cochlear implant space want it to be tackled as much as the people in the pediatric amplification space and all that.
And maybe as a vestibular, I'm like, I can't wait till the vestibular one comes.
Right. I totally hear you. Well, this is, it's fascinating. I really admire the work, and I'm sure, I'm being a little facetious. You're not doing it for the pay. Right. And so I do really admire our colleagues and professionals such as yourself who are willing to put in that extra, and frankly, for the audience, unpaid time to do all of this work to make sure that the profession and, more importantly, patients are well treated, because ultimately that's the goal, right?
Yes.
Is to make sure that patients are well treated, right?
Yeah, patient care.
Yeah. So that this is really wonderful work. And again, thank you for doing all that. You and your organization, and you as your representation of the organization. So question I have for you, say we had an award ceremony and we said, Tish, who do you have to thank for getting you here? In other words, who are those people that you would say, these are the people that helped me get to where I am today? Who are those mentors? It's always important to have great people to help you. Who would you think?
So, obviously most people would say their family, which I would agree as well. As far as professional mentors, two really helped me a lot throughout my profession. One is Catherine Palmer, who was my professor at University of Pittsburgh. She really helped me, especially in those early years, kind of getting going and supporting me in that way. Another mentor is Dave Fabry. So when I was a student, I was on the board of directors for the National Association for Future Doctors of Audiology, or NAFTA.
Yeah, I remember when that existed. It rolled
Yeah,
in.
good old NAFTA. So I was on the board when I was a student, and he was one of our advisors. And so, I would reach out to him for help, and he has always been very supportive throughout the years. And it's been nice to be able to work with both of them now professionally as an adult audiologist instead of a student. Right. So those would be two. One other person would be Devin McCaslin from the vestibular side.
Well, that's wonderful to have people.
Yeah.
So, and then the other question I love asking is, what's your favorite sound?
Okay, so I've been
for the audience,
trying to think of
I
something.
told her this question beforehand, so
he prepped me because I was having a hard time. So there's a couple things that are favorite sounds. But one of my favorite sounds is, my brother and I are very close. We grew up in a very interesting kind of situation. And so the one thing is that nobody makes me laugh harder than my brother. And it's when he starts laughing and I start laughing, I literally tears are falling down my face because I'm laughing so hard. So that's probably one of my favorite sounds is him cracking up. Yeah.
Yeah, I'm dating myself to some extent, but there used to be Hollywood Squares, and I don't know if you remember that show.
Yeah.
There was a comedian on that, Paul Lynn, and he actually wasn't that funny, but the way he laughed made you laugh. So it's but obviously your familiarity with your brother, that's really a wonderful story, and I'm blessed to have siblings that do the same for me. Well, we have Dr. Patricia Gaffney here. She's a professor at Nova Southeastern University in Fort Lauderdale. If people wanted to get a hold of you, how would they get a hold of you?
They can email me at my Nova email address, which is pgaffney, so GAF as in Frank, FNEY @nova.edu.
And she's on LinkedIn. I know that as well. So, well, this has been great. I really appreciate your time. I really admire the work you guys are doing. And actually, when I get off, I'm going to go look at the standards again. I looked at them for a little bit, but I want to go review them again. Thank you so much for this great work. And thank you for coming on and sharing with us what you're doing. And I wish you the best and look forward to maybe reviewing some other guidelines with other members of the committee or yourself.
Great. Thank you so much for having me.
Oh, thanks. Thanks for coming on.
Thanks for tuning in to the Listen Up podcast. We'll see you again next time, and be sure to click subscribe to get updates on future episodes.